also do something, even if it is for free, because with public health, we're not doing it just for money or anything else, but for the benefit of everyone.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions Podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll! Welcome to another episode of the African NCD Champions Podcast, and today we are going to talk to one of the digital health advocates working on various digital health advocacy topics, and he'll be sharing his story, how he got into digital advocacy, what he's doing in digital advocacy line, and what you might learn from him. Without further ado, could you give us a quick introduction to yourself and what you do?
Oh, thank you, Stephen. My name is Morgan Kegesa. I'm a law student at Kenyatta University in Kenya and a digital advocate. So currently I'm working on various projects around non-communicable diseases. That is the prevention part of it. Currently, just to name but a few, alcohol control and tobacco taxation, and also transfers elimination in East Africa.
Interesting. So you said you're a lawyer, but you are also a digital health advocate. So what is the story? How did you come from law? What's your background in law, and how did it lead up to you being a digital health advocate?
Thank you. So for law, that has been my lifelong dream, being a lawyer after university. So with digital advocacy, law is all about advocacy. So as a lawyer, I found myself into the advocacy part of health, whereby I wanted to exercise to exercise my advocacy skills in the whole subject of digital health, and see how I can marry the law part, legal and health.
Yeah. So what are the topics that you've advocated for before, and what have been their passion areas in terms of the digital health advocacy?
So we have tobacco control and alcohol taxation and policy, also transfers elimination, and at the moment food policy. So for cutting across all of them is one thing, and that is policy. I think that is my area of interest at the moment, where I'm not much into the science or economics, but policy, which has everything to do with legal.
Yeah. So what have you seen as some of in your lines of advocacy? So say the different topics that you've worked on transfers, on alcohol, on sexual reproductive health, you mentioned. What has been some of your favorite topics that you've gotten to advocate on? And so what have been some of those favorite topics?
So some of the favorite topics is industry interference, creating awareness on the consumers on how the industry is aggressively hooking them into their products in the name of providing whatever they're producing to them. And at the end of the day, it is the consumer who's losing and the industry gaining. So I think I've been doing a lot of work online to show the consumer what really happens behind the scenes. That is, it is not them gaining at the end of the day.
What have you seen as some of the industry tactics when it comes to the industry interfering with different health actions and promoting their products instead of promoting healthy living?
So the greatest tactic that they're using is marketing. They have employed a lot of resources in terms of manpower, finance. They're so determined to market their products at the expense of the health of the consumer.
Yeah. And have you seen, especially working in different specific industries, so say the tobacco or the alcohol or the trans fats, among those industries, what are some of the more specific examples that you've noticed industry coming through and interfering?
So with advertisements, they are glamorizing their products, making them appealing to their target audience. And unfortunately, it is kids, minors at that, and young adults, that is the youth, who are being targeted by the industry. So they are using influential people in that age bracket, and that is to name the youth and market their products so that they would hook more and more young people into consuming their products and becoming slaves.
Yeah, and I think we see that in the various industries. So, for example, the tobacco industry has marketed a lot of their products to young people, rebranding them every time and bringing new forms to ensure that young people are hooked in YouTube, on cartoons, and they're making unhealthy foods very colorful, using the color science to make it attractive to kids. We see the alcohol industry bringing in different forms of alcohol and putting pictures of fruits and vegetables on those alcohols to give the public a perception that those images are that those products are healthy because they have the pictures of apples or oranges on their banners, despite the fact that those are primarily alcoholic products. Which brings me to the next question, looking at or analyzing the policy space when it comes to digital health advocacy. Why do we see a lot of lawyers go into the digital health advocacy space? And if not, why do you think that is the case?
So we need to have robust policies in place and effective ones at that in all spaces that have everything to do with advocacy. For alcohol and other products, including food and tobacco, we need to have our laws working. So, for example, in Kenya, our jurisdiction, we have consumer rights. So these rights are found in the Bill of Rights, and consumer rights are human rights. So consumer rights is a human right issue. So we need our consumers protected by our laws. That is the Constitution and all other substantive laws. So lawyers, what are doing is trying to make these laws work for not only for consumers, but to have everyone, including all stakeholders, that is the industry, the retailers and everyone, adhering to the law while they are doing their businesses. And at the end of the day, it's the consumer who will be protected.
In my experience, I have not seen a lot of lawyers being actively engaged in the digital health space. Do you think we need more lawyers in the space?
Yeah, we just don't need them working in-house, that is in organizations, and maybe in the court litigating. We also want them here because I think this is a new space for lawyers who maybe they also have a passion in digital advocacy and media, to try and see how they will navigate in this digital space so as to increase more awareness to the people, and also for their own benefit. They'll end up networking with lawyers around the world, even in countries that are very serious in advocacy and human rights law, which the consumer rights fall under.
Yeah. So moving up ahead, what would you say are some of your biggest achievements as a digital health advocate?
As a digital health advocate, I've had I've had many opportunities of being involved actively in policy making, not as a policy maker, but as someone who sits in working groups that have been forwarding proposals to the relevant stakeholders in government. So, for example, with the regulations on tobacco, that is the graphic health warning signs. So, as part of an organization that is YIPA, the newest kid in the block in youth-led organization on tobacco control in the country. That is the Kenyan chapter, because we have also other chapters in South Africa and I guess Zambia. So YIPA was part of the team that was working with the Minister of Health in coming up with new graphic health warning signs, that is suggestions, proposals that were suggested to be part of the tobacco products, the tobacco and nicotine products in the country.
Yeah, so you worked with the team that actually helped realize the graphic health warnings for the different tobacco products.
They have not yet been regularized in Parliament, but yeah, that is an achievement.
It's work in progress.
Yeah. On trans fats elimination, which is part of the project that I'm also in. So in East Africa, I'm part of the coalition, which is being coordinated by GAHI. And we want to also work with relevant stakeholders and eliminate the consumption of trans fat in East Africa. Also, on tobacco control, I was part of the digital team in Kenya, because on the 31st of May, we had a campaign on awareness, so that we'd help people see that the tobacco industry is using tactics on them and normalizing the consumption of their products in kids and young adults. So it's part of the digital team that was really doing a good job in making things.
And I see, and that is during the World No Tobacco Day. Yeah. So, final question. What would be the key, what would you advise other young people who wanted to enter into the digital health advocacy space? What should they do, and how can they work in this space?
So I should be on the prize first, and that is you look for people who you think like-minded people doing big in the digital space. That is organizations, figures, be it lawyers, be it medics, be it nutritionists, anyone in the digital space that you think that you would want to work with them or be like them in the future. You just reach out to them, maybe on their digital pages, that is social pages, just reach to them, and I know one day you'll find yourself there. For starters, you should also do something, even if it is for free, because with public health, you're not doing it just for money or anything else, but for the benefit of everyone.
I think that is a very good closing remarks, where you're encouraging young people to really be proactive and reach out to other established health advocates who could really help guide and mentor them, and also have the passion and have eyes on the prize, as you put it, and also focus and on their work, and even do a lot of free work to also help the communities, because again, public health is both for you but also for the communities that you serve. I think that brings us to a nice concluding remark, unless you have a closing parting shot in like 30 seconds to 1 minute that you'd like people out there who will watch this to know or to pay attention to.
So at the risk of reiterating, the room is so big for everyone. You can, with the digital space that I mean, so it has lawyers, people in the media, medics, everyone. So feel free to reach out to anyone that you think you can work with or for, that is an organization, and you'll be accommodated. At the end of the day, you're working to save people's lives.
Yeah, and I think that's a very good closing remarks, and I think we'll end it at that. Thank you very much for coming, for sharing your thoughts and insights, and let's do this again some other time.
Yeah, pleasure.
All right, bye for now. Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.